Both of these patients of mine had shoulder pain when pressing overhead, but for completely different reasons. You see, the shoulder joint is one of the most intricate in the entire body. Pain in the front of the shoulder can actually be caused by any one of these problems. This is why there is no one-size-fits-all approach to fixing any injury, including shoulder pain. For example, when looking at Tyler's shoulders when pressing, you can notice a big difference in his positioning. Testing his range of motion with his shoulder in an internally rotated position showed no differences. However, when externally rotating, he was stiff and unable to reach as far on his painful left side, confirming he was experiencing a flexibility issue in his lats and teres major muscles. Now, on the other hand, Olu had a blocking pain sensation when raising his arm in an internally rotated position and more motion when externally rotating his shoulder, the opposite of Tyler. So already, one test into our evaluation process, and both athletes are showing different results in how their shoulder pain is recreated. One area that was similar for both was that both were very weak with these strength tests. You can see both Tyler and Olu had difficult times resisting my push with only a few fingers, meaning they were dealing with mid and low trap relative weakness. So based on these tests so far, we can say Olu's shoulder pain was related to a strength imbalance of being very anterior dominant, whereas Tyler's pain was recreated not only due to a strength and stability imbalance, but also a flexibility restriction as well. So while both perform stability drills to enhance their posterior shoulder strength and coordination, such as this banded rotation and raise Tyler's demonstrating here, in the D2 flexion diagonal raise that Olu is showing here, Tyler also required some soft tissue work and stretching for his restricted lats. But with this approach, Olu was able to show improved pain-free motion and get back to pressing pain-free, and Tyler was able to show improved pain-free motion and get back to pressing pain-free as well. So if you're Googling how to fix shoulder pain when lifting, and the place you stumble upon doesn't look at all the potential factors that could lead to shoulder pain, you're at the wrong place.